Well, along with lovely blooms and warmer days comes a less welcome sign of spring.
Allergy season, as you may know, is in full swing in Wisconsin, and with anxieties very high about coronavirus, some patients are confusing allergy symptoms with the virus. Dr. Mark Moss is an allergist with UW Health. Dr. Moss, welcome to Live-at-Four. Great to see you.
Hi, thanks for having me on the show.
This is causing a lot of confusion and concern. So what is the difference between symptoms?
Most people that have allergy, hay fever in the spring or in the fall, are going to have a lot of nasal and eye symptoms, most commonly sneezing, itchy nose, itchy watery eyes. And as most people find, these are going to be very seasonal. Predictable, and symptoms that they've typically had for multiple years that may be growing over time.
But some of those symptoms are similar to COVID-19 symptoms.
Yeah, the challenge is that most people that have symptoms of COVID-19 are going to have a wide variety of symptoms, but one set of symptoms they don't typically have are the nasal and eye symptoms. They typically have fever, fatigue, and they have shortness of breath that is very different. It's this air hunger that can develop over time.
What about a cough? Can allergies make you cough?
Yeah, that's where things become a little tricky, because certainly people that have postnasal drainage can have coughing. But again, it's going to be usually in the context of having those upper airway symptoms, the nasal congestion, nasal drainage, having to blow your nose frequently. And generally, people that have COVID-19 don't tend to have those set of symptoms. The big challenge that can occur, though, is for patients who have asthma as well as allergy. And asthma, of course, can lead to coughing and shortness of breath and wheezing. Fortunately, most people that have asthma know what their symptoms are like when their asthma flares. And when people have had COVID-19 and have asthma, they're describing the shortness of breath they're experiencing as being very different.
So can you treat allergies?
It definitely. Allergy symptoms, again, are fairly predictable in terms of the season. Of course, if you've had allergy testing, you should know what your season is. And most symptoms can be treated with over-the-counter medications, including antihistamines, a number of nasal steroid medications, and antihistamine eye drops. So people that are using these medications definitely should continue to take them, because they're going to help mask and prevent the allergy symptoms. And they're also going to be very safe to take in the context of any viral infection, let alone COVID or coronavirus infections.
So the over-the-counter antihistamines work. You don't need a prescription.
That's right. I mean, the vast majority of people can treat their symptoms very adequately now with a variety of over-the-counter medicines. Certainly people that have symptoms that are breaking through over-the-counter medications can seek care from a healthcare provider for additional prescription options, which there are many. Or maybe receive a referral to an allergy specialist for a further discussion with allergy testing and discussion of some of the other treatments that we can provide.
All right, so don't be that concerned. It's just the blooms for the most part.
And I think a lot of people have...
I know, you cough these days and you get the death stare.
Very, very quickly, doctor, can you develop allergy symptoms as an adult if you've never had allergy issues before?
Most definitely. We see a lot of children, and a lot of symptoms develop in the teenage years or even before that. But there are some individuals that develop allergy symptoms as adults. And again, it's typically, sneezing, itchy nose, itchy, watery eyes. If those are happening, try over-the-counter medications first. And then if that's not helping, consider contacting your healthcare provider. But right now, pollen counts are high, especially tree pollen, and now we're coming into grass pollen season.
Well, doctor, thanks for being with us today.
Thank
Great
you,
information.
Dr. Moss. Great to see you.
Thank you. Have a nice day.
You too.